Hello, my name is Dr. Rochelle Santopoalo. I'm a registered nurse, and I'm here today to talk with you about healthcare advoc- advocacy. The name of the presentation is Taking on Healthcare by the Horns. The goal of the presentation is to learn advocacy strategies to help you successfully manage your healthcare needs or those of someone you care for. We have three learning objectives: define and differentiate three advocacy models, examine what is a healthcare advocacy perspective, and propose transitioning to a healthcare advocacy role. The three patient advocacy models. A little background. When I was in nursing school, which was in 1972, we were indoctrinated in the identification of our role as advocates for our patients. Well, that was a nice idea, and at the time we had a lot of nurses. However, I really felt that patients needed to know how to advocate for themselves. The other point to consider is that nowadays, with staffing being what it is, nurses really do not have the time to serve in the capacity as an advocate. So, patient and a loved one will literally have to serve in that capacity. So, the first model is self advocacy, and that's where the patient is able to obtain and effectively manage daily healthcare needs. Probably a good 50% of folks will wind up being able to use this model. They'll be able to manage the day to day things that are needed to support their healthcare needs at home or in the hospital. If they're at home, they may need support services, and they're usually able to manage those services, such as home health care, outside meal service, outside therapy. They're able to manage assistive devices independently. If they are hospitalized, they're able to make decisions for short term elective admission. In model number two, think of this as being on a healthcare continuum, where in model number two, the needs of the patient are greater. And as such, you more than likely are going to need somebody else to help you. And that's because as a patient, it is very hard to be your own advocate. As I said, when I was in nursing school back in the 70s, oh, I thought it was a great idea that a patient should be able to advocate for themselves. Yeah, well, I was in my 20s then. And then fast forward a couple decades, and then I became a patient. And guess what I found out? That I couldn't advocate for myself. And that was for many reasons. Number one, I was institutionalized. A lot of my independence was taken away from me. I found I wasn't the same kind of person I was prior to being in the hospital. I also, more likely than not, was taking some kind of medication that would make me have brain fog. I was fatigued because, I mean, who sleeps in the hospital? I certainly never did. And you oftentimes have pain. So, being your own advocate, once you've been hospitalized past a few days, gets really hard. And that's where we get into model number two. And we benefit from advice and assistance of a healthcare advocate. And that person helps to safeguard a patient, monitors to make sure there's appropriate delivery of health care, serves an advisor for patient and their families, serves as unofficial patient proxy. A patient proxy or healthcare surrogate is actually a legal role. A patient advocate does not have any legal bearings. The shared advocacy also allows somebody to interpret what I call health speak to patient and family. Now, because I've been in healthcare for many decades. Um, I understand all that stuff, but the average person really doesn't. I've got some neighbors of mine where her husband has got hydrocephalus. Now, of course, their only exposure to that term has been as it applies to young people, but her husband's in his 70s. And more we are finding that patients that are elderly and that have signs of dementia just may have hydrocephalus. And when that happens, then they have to have a drain put in. And well, that's all very confusing to his wife and to, well, he doesn't even understand what's going on. So as a geriatric case manager, I work with her on that. More and more, we're finding that if people are hospitalized, it's for situations that are more complex. But there's a new trend in healthcare, and that is called hospital at home program. That's where people are expected to manage complex machinery. Believe it or not, people are getting dialysis at home. They're getting 24/7 IV therapy. Wound management is much more complicated than it used to be, and people are getting it at home. Now, not surprisingly, tracheostomy and ventilators have been managed at home for a long time, but usually it's been with pediatric cases. But with COVID, that kind of changed things because we didn't have space in a hospital. So then the next level of care that we need at a patient advocacy intervention is another shared advocacy, but it requires the healthcare advocate to take on an even more active role. Such things as not only monitoring if somebody's taken their meds, but making sure that they are ordered. And let me tell you how difficult that is. Just recently, I was in the hospital and wound up going home. And I have a lot of medications, and normally I would be able to manage it. But I had some cognitive involvement at the time, and so the home health care nurse suggested I get the prepackaged medications. Well, that sounded like a great idea because I'd been managing my medications for the longest time. Well, I kind of dropped the ball, or they did, I'm not sure. But anyways, what I found out within a couple weeks is I didn't have the right medications in those packages. And I was at a point where, if possible, I would have loved to have had a healthcare advocate because I needed some more intervention that I just couldn't do. And I needed somebody to kind of like being the ringmaster. Let's go the other way. Okay, now let's go to healthcare advocacy primer, advocating for your healthcare or someone else's. And that starts with the right perspective. How do you think? Now, not everybody can be a healthcare advocate. The little secret is that your spouse may love you, but that doesn't mean they can be your advocate or that they can be your caregiver. If they can't, accept it because if you push the idea onto them, they will resent it and it'll never be the same. So, the first thing in picking up a right perspective as an advocate is to accept that you will have to participate in managing your health care. I know a number of people who sit back and let the healthcare team take care of them. And they forget that they have an active role because, in the long run, whose healthcare is it? Whose body is it? It's yours. Also, number two, keep or bring a list of your medications with you to each doctor's appointment. Again, as your own advocate, or if somebody else is doing it, they would need to bring the list of medications. But assume that whichever doctor you are seeing, they are going to need to see your medications every single time. Number three. Now, number three is kind of like the obvious thing, but many people forget. Come prepared to your appointment with written, pertinent questions because your doctor is always going to ask you, what are you here for? And if you sit there and say, oh, just, routine checkup, well, then your doctor is going to assume that everything is fine. Don't count on your memory to remember what's going to be important. Number four, if your doctor wants you to modify your diet, do your best. Food is medicine. Year and a half ago, I had open heart surgery, and I knew as a nurse I was supposed to be on a low salt diet. Somehow my doctors never told me that. But, anyways, I knew it. So I put myself on a low salt diet when I got out and, well, lost a lot of weight, and it really was very helpful. So, if your doctor wants you to modify your diet, do your best. You're not going to be 100%, but you take on that responsibility. And if your doctor doesn't give you the resources to take care of yourself, you need to find them. Take in information the way it makes sense to you. Myself, I am not an auditory learner. I'm the kind of person, if I stop at a gas station to get directions, I have to write them down because listening to them, it goes in one ear and out the other, or it sounds like blah, 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 blah. So healthcare people have a tendency, they think as long as they are speaking to you and they tell you once that you've got it. That's not true. Ask for things in writing if you need to. Make sure you understand what your healthcare provider is telling you. Now, this may be a good time when having an outside healthcare advisor come with you because two sets of ears is always better. Take all of your meds as prescribed and report any side effects promptly. I can't tell you how many people stop their blood pressure medications because, as far as they're concerned, they feel fine. Well, maybe they're checking their blood pressure and maybe they're not, but they confuse feeling fine with their health condition being under control. Number eight, use your resources or find them. And your pharmacist is such a great resource. I can't tell you how much more they know about medications, well, than your doctor does. So do use them. Let's go back the other way for the rest of the primer. Manage extended wait times for your appointment. Now, it would be lovely if we only had a 5-minute wait when we go to see our doctor. Well, we know that's not true. I have two doctors. Every time I go, it's either a 2 hour or a 3 hour wait. It's infuriating, yes, but both of them are very good. And when I get my turn to sit in that chair, I am all theirs, and they give me 100% of their attention. Another thing to consider when you are serving as your own healthcare advocate, or what we'll talk about in a moment, somebody being brought in, is that most healthcare workers got into the field because they want to help people. Let me tell you, there are much easier ways of making money than being in healthcare. Number 11, even the most dedicated healthcare worker has reached their empathy fatigue limit, especially with the COVID pandemic that we've had the last couple of years. Number 13, being able to advocate for yourself, especially with complex medical problems, as I mentioned before, can be very difficult in part due to fatigue, the effect of medications and treatments, the lack of sleep, and pain. I was in a rehab center over the fall term, and the noise was constant. There's no way I could have slept. And besides, Have you ever slept in a comfortable bed in the hospital? Oh my goodness. No. Number 24, the more independent we are, the more difficult it is for us to ask for help. Let me repeat that because it's worth repeating. The more independent we are, the more difficult it is for us to ask for help because typically we are the ones who offer help. If you have somebody like that in your life and they need help managing their health care, be a good friend, offer to help. More often than not, your friend will appreciate it and will accept it. As an advocate for someone else, be willing to take on a different, more assertive persona. Let me explain that. Okay, consider you are about to get into a fancy little sports car so you got there. Given your choice, do you prefer to sit in the driver's seat or the back seat? Well, neither seat is right in every situation, and each of us has a preference of where we prefer to sit. But there are situations when we need to sit elsewhere. Ask yourself, where would you prefer to sit? In the back seat or the front seat? Mm, I'm a front seat person. I'm a driver personality, in case you couldn't tell. But that doesn't always serve me well. And I have to look at the situation and decide. And that's what the last sentence is. Given your usual preference to function most effectively as a healthcare advocate, which would be a representative for a good friend or family member, you'll need to sit in the best seat for the situation. So, with my driver personality, it may not always be effective. And I may need to sit in the back seat and just cool my heels. But on the other hand, I may have somebody who's available who needs to get from the back seat to the front seat. Case in point, years ago I had a rotator cuff surgery repair. That night, the pain was so bad, I had my sister in law, who was staying with me, take me to the local emergency room of the hospital where I had had surgery. Now, I love my sister in law, and normally she's a laid back person, and that works just fine. But I explained to her that I was in significant pain and that I needed to really let the healthcare providers know that I was really in a lot of pain and that I needed her to go along with me and act more active than how she normally does because, well, my sister in law's just a sweet person. So I started moaning that I was in pain. Well, and they still didn't come in. So I had to escalate it. Okay, now I'm serving as my own healthcare advocate at this point. All right, well, nobody comes in. So I have to embellish it a little bit more. And my sister in law had to go along with that. And when healthcare people did come in, she stepped right up and started saying, you've got to do something for my sister in law. She's in terrible pain. She had surgery this morning. And it wasn't easy for her because that's not her normal. But to be effective, she had to take on a different role. And that brings us to the topic of transitioning to the role of a healthcare advisor. Mm, We'll go over a series of do's and don'ts. Start with the do's. If you are going to be a good healthcare advocate for your friend or for yourself, There's a series of things you should do. There's a series of things you should not do. Do's. And take this from somebody who's been a patient a number of times and who's worked as a clinical nurse and who has worked as an administrator in nursing. These are tried and true approaches. Record the full name of each healthcare team member you speak with, including their title and the day, date, and time you spoke with them. The thing about getting their title is interesting. I have a doctor who has an associate, and she never told me her title. But quite honestly, she kind of acted like a nurse. The way she talked, the way she acted. So, I'm like, okay, I'll buy off on it. So I thought she was a nurse. Oh, well, then I come to find out she's a medical assistant. So it is important to know the title of the person, and they may or may not be wearing their name tag, and they may or may not have their title on their name tag. But if you're over the phone, you wouldn't see that anyways. So do make sure you record all this information. Number two, negotiate a follow up time for a follow up on a conversation. For example, if I talk with my doctor and I ask the person I am speaking with, the healthcare clinician, when can I expect an answer to my question? And those are words you can quote me. And if they say, well, which they might, you say, okay, how about if I call you in a week? Would that be okay? They're more likely going to say that's okay. And then you schedule yourself on a calendar so that you make sure you follow up. Make sure as a healthcare advocate you are asking for something and do be persistent. Persistence is an underrated characteristic. It's more important than so many things. It's more important than intelligence to just show up. Number five, initiate coordinating of services between healthcare team members. You wouldn't think you'd have to do this, but you do, because healthcare team members are almost like in separate tribes and they don't speak to each other. Now, their staff may, but as we get to the don'ts, you'll see under number five, do not assume doctors speak to each other. Trust me, they don't. The idea for a doctor to call another doctor up on the phone is rare, but when they do it, it works. One of the don'ts, and they kind of go back and forth between do's and don'ts, don't get partial information from your healthcare team member that you speak with because you will more than likely need to use that as your paper trail. Do not wait for a member of the healthcare team to contact you. I've got a couple of friends of mine that live down the street from me, and it took me a year to convince her because her husband had a lot of complications with his medical situation. And she was waiting, like a good girl, for the healthcare team member to contact her. I'm like, no, no, no. You have to take the initiative. You have to drive this car. But on the same hand, don't be demanding. Always be nice. Don't be obnoxious. Always be nice. Because again, these healthcare workers are just, they're overworked. They're truly underpaid. And they really are not appreciated. So if you show a little appreciation, say thank you. It is amazing how much more effective it is. And number five, we've already addressed assume doctors speak to each other because they don't. Okay, let me go back the other way. Oops. Other transitionings. Do be polite. Don't be rude. You want to make sure that when you call, somebody's going to take your phone call. But if you call and you're nasty and impertinent and impatient, nobody's going to want to talk to you. And then if you're the person who's doing the advocation for yourself or for somebody else, you're going to not get anywhere. Number two, under do. Come prepared with questions in writing to an appointment. If you come to an appointment with the doctor and you have no questions in writing, they're going to assume that everything's okay, and it may not be. The other thing is don't rely on your memory to remember important questions. It's like going to the grocery store and knowing that you had five things on a list, but the list is at home. You're not going to remember. Write it down, bring it with you. Number three, take responsibility for your own health. Do not think that somebody else, whether they're your healthcare advocate or not, is going to be responsible for you because they won't. And in other words, under don't place responsibility for your health onto others, and specifically the healthcare team, or maybe a family member. Don't assume that your family member is going to be responsible for you. You have to be a partner, and that's where the concept of shared advocacy comes in. Another do, and I say this because this is a lesson I need to learn. Get to your appointment 15 minutes early. It really does make a difference. Don't be late for an appointment and expect to be seen. When I am late for an appointment, which happens on a rare occasion, but it does happen, I have to expect that I will not be seen. And depending on the doctor, I might not be seen. And depending on what the doctor is doing that day, I might not be seen. Just last week, I had an appointment with my OB/GYN doctor. Well, she was late. Well, she was birthing babies. And then I had an appointment that afternoon with my orthopedic surgeon. So, of course, I was late for him. I didn't expect that I would be seen, but luckily he was nice and he stuck around for me. But, if I'm not there on time, they've got times that they have to keep steady with. Under dues, do keep several running journals, one for each healthcare provider. If you have little pieces of paper all over and there's no paper trail, or if you write in several different journals about one healthcare problem, trying to track that down is impossible. So I love Dollar Tree. They have great little journals there that I can get for $1, and I buy them a lot. And I put on the title who the healthcare provider is, and I only use that journal for that healthcare provider. It's a simple strategy, but it is effective. And number five on the don't, do not rely on your memory to remember important information. As people get into more complex situations, it becomes more and more difficult. And that's where these kinds of actions become much more important. One of the things to remember is that healthcare advocates are difficult to find. Think about it. There is one master's program in nursing. It is St. Lawrence College in New York that prepares nurses to be advocates. There is no other program. What there is a certification program. Now, what's interesting about the certification program is it is geared for people who really do not have a healthcare background. Now, if you remember, let's see if we can go back to our patient advocacy model. Model number one, self advocacy. Somebody's not really that sick. All right, you just need somebody who's got the attitude, the personality to serve as an advocate. But when you get to model number two and model number three, you do need somebody with a healthcare background. The certificate that is offered by an organization, which we'll talk about in a moment, has a wide scope of what they expect people to know, but they learn it without underpinning of understanding healthcare. More often than not, they are people who have helped a family member or they themselves have been in a situation where they learned a lot and they want to help other people. So, if you are shopping for a healthcare advocate, we'll talk about that in a moment. Be careful if you have complex healthcare needs that you are hiring somebody who has got a clinical background. All right, let's look at what the resources are. These are healthcare advocate resources. Many of these have directories because, quite honestly, healthcare advocates are very difficult to find. The one that I found has the best directory is number three, Greater National Advocates, and their website is gnanow.org. The others have websites that have directories, and depending on where you live, they may or may not have people that can help you. If not, look for, in the best of worlds, somebody who is a nurse practitioner because nurse practitioners are graduate prepared and they have to go through special licensing. And as you get more ill, you want somebody with more sophisticated knowledge. My closing words of wisdom for transitioning to a healthcare advocate role, and that is from being a normal person of who you are to being somebody who can advocate for their health or somebody else's. I have three quotes to offer you. Number one, it is better to know some of the questions than all of the answers by James Thurber. I've always thought answers are easy, but if you don't ask the right question, you are not going to get the answer that you need. So think about what your questions are, and that's why you need to write them down. Number two, by James Baldwin. Not everything that is faced can be changed, but nothing can be changed until it is faced. May sound obvious, but it is the truth. And how many of us don't want to face certain things? Case in point, a friend of mine was having back surgery the other day, and a group of us were out to dinner. And I brought up the topic of who is going to be her healthcare surrogate because she hadn't decided. I also asked her if she wanted to be cremated or buried. Well, one of her friends just bristled at that and said, "Oh, such a morbid topic over dinner." And she said, "Let's not talk about it." I'm like, "No, we are going to talk about it because our friend had not faced the fact that she needed to make some decisions, and she was a nurse. What she wanted instead, and she's got 5 children, she figured her children would work it out. I'm like, no, 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 you know that doesn't work. They need to know what you want. So the individual patient has to make some decisions. And the last quote is the only difference between success and failure is the ability to take action. How many of us know people who are really smart but don't do anything about it? Again, that goes back to the idea that persistence will always outweigh intelligence. I know many, many smart people, but It's a secret and they don't do anything with it. So take action when action is needed. And in fact, let me leave you in closing with a thought. In a perfect world, you would be able to hire someone to take on this role as a healthcare advocate. But by and large, they do not exist. Instead, you may need to hire a nurse practitioner or negotiate with a friend and work with them on how to take on the persona of being a healthcare advocate. And that's what will be the most helpful to you. So, this presentation, Taking on Healthcare by the Horns, our goal has been to learn advocacy strategies to help you successfully manage your healthcare needs or those of someone you care for. We've gone over 3 learning objectives. Number 1, define and differentiate 3 advocacy models. Number 2, examine what is a healthcare advocacy perspective. And number 3, propose transitioning to a healthcare advocacy role. I hope this information has helped you to start planning to become your own healthcare advocate or to have somebody else serve in that capacity. If you would like a copy of this PowerPoint program, send your request to librarian@leesburgflorida.gov.